Tensions are high right now. As the Delta variant spreads like wildfire across the US, vaccination rates are still low in many places and parents and school staff are anxiously wondering what will happen as schools start up again. Should there be more mask mandates? Will businesses have to close again? Will big gatherings be banned? There are no clear, simple answers to these difficult questions. In some places, officials and employers in the same locale are making different decisions. But for those looking to the scientific evidence for guidance, here are some things a team of researchers at the University of Pittsburgh and Carnegie Mellon University have learned since the pandemic began that can help. The overall message from their analysis of state-by-state US data is this: even moderate restrictions on the size of gatherings, and some level of mask requirements can help slow a surge of COVID-19 cases, if implemented at the right time. The scientists have kept a detailed database of statewide restrictions from March 2020 to March 2021, documenting when they went into effect, when they were lifted, and the impact they had on case and death numbers in each state. They recently published a preliminary analysis of that data online, which is in the process of being peer-reviewed. As we go into the fall, when schools are going to go back in person and we do not have the vaccine coverage that we need to have to reduce the spread of SARS-CoV-2, we need to be thinking harder about putting interventions on, says Seema Lakdawala, an assistant professor and flu researcher in the Department of Microbiology and Molecular Genetics at the University of Pittsburgh, who was one of the project leads. It doesn't mean that we have to stay at home and we can't go out anymore and we can't see our friends anymore, she says. It just might mean bringing back some level of masking requirements and gathering restrictions to help keep transmission under control. As communities and policymakers consider how to manage the threat of this Delta surge, here are some lessons to keep in mind that Lakdawala's team and their collaborators at Carnegie Mellon University have learned from the first 18 months of pandemic restrictions. Throughout the pandemic, states, and even counties and cities within those states, have often done their own thing. Transmission has varied, residents' willingness to comply with restrictions has varied. Especially in the beginning, it was a real grab bag, says Lakdawala. A lot of states were putting restrictions on and then taking them off and then putting them on and taking them off. It was really haphazard, she says.